pathological variations of erythrocytes. So as you know, the normal count of erythrocytes is 4 to 5.5 millions per cubic millimeter of blood. Okay, so regarding the physiological variations, okay, so physiological variations regarding the sex, the female having less erythrocytes as compared to the males, and as well as because of the hormones, testosterone is present in the male, and female the testosterone is not secreted. And as well as, so those people, they are living in the high altitude or in the hill stations, so those people always having the high erythrocyte count as compared to the those people they are living in the ground areas, because in the hill stations, in the high altitude area, so where the oxygen is not present, so due to deficiency of oxygen, it can cause the hypoxia in the body. Okay, so hypoxia nothing but deficiency of oxygen in the body. So that hypoxia, it can stimulate the formations of more RBC. So that's why. So when you are suddenly living in the hill stations like Mahabaleshwar, immediately your RBC count was increases. It does not indicate you are suffering from the cancer. Okay, it indicates you are living in the high altitude or hill station, due to that where the oxygen is deficiency or deficient, so that was causes the hypoxia in our body. So due to hypoxia, the erythrocyte count is increases. So that's why you always these physiological variations should be considered for predictions of the results, because during the pathological variation it can use the clues regarding if the erythrocyte count is more than 7, so that condition is known as the polycythemia. Okay, it is the abnormal conditions of the RBC count, or it is responsible for to cause of the or responsible for various kind of the tumor or cancer was produces in our body. On that time you can consider the physiological variations, because if that person's in the past 1 week or 1 month he is living for some time in the hill stations like Mahabaleshwar, Simla, Kullu, Manali, for that person always having the high RBC, it does not indicate that so that person was suffering from the cancer. So that's why, so those physiological variation is also considered for diagnosis of the pathological variations during the erythrocyte count. Or if those people they are athletics, daily they are runnings, so they are involved in the aerobic as well as cardiac exercise. Okay, daily morning they can go for the fast running for half an hour, 1 hour, or 5 kilometer, 10 kilometer, and such people is also having the high RBC. Okay, that also keep in your mind during the interpretations of the erythrocytes result. You ask their normal lifestyle. Okay, if they are athletics, definitely, so that increased erythrocyte count is not related to the cancer, it related to their physics or daily activities. Okay, as well as you can consider the sex also, whether they are male or females. The male is also having the high erythrocyte count as compared to the female. So those are the physiological variations. And regarding pathological variations, if the erythrocyte count is increases, if it is more than 7 millions per cubic millimeter of blood, so that was known as the polycythemia. Once again, the polycythemia, so they are categorized into two types, that is the primary polycythemia and secondary polycythemia. And polycythemia was differentiated so with the help of the WC count. In the case of the primary polycythemia, you can note down the range of RBC along with the range of the WBC. In the primary polycythemia, the RBC count is more than 14 millions per cubic millimeter of blood, along with the WBC count is more than 24,000 cells per cubic millimeter of blood. If the same conditions was present in the report means, so that indicates so that person was suffering from the that is primary polycythemia. But WBC count is normal, only the RBC count is increases. So that indicates so that patient was suffering from the secondary polycythemia. And primary polycythemia, it can result during the malignancy of RBM, that is the cancer of the red bone marrow. Okay, so where the RBC count is more than 14 millions per cubic meter blood, along with the WC count is more than 24,000 cells per cubic millimeter blood. If such results, if you are found in the report, means so that indicates so that patient or person is suffering from the blood cancer or malignancy of the RBM or cancer of the red bone marrow. But WC count is normal, but RBC count is increases. So that was known as the secondary polycythemia. And secondary polycythemia is results during the brain tumor, liver tumor, and uterine tumor. In the case of the brain tumor or liver cirrhosis, and as well as the uterine tumor. So where the secondary polycythemia can be results, and as well as chronic carbon monoxide exposure. Okay, during any burning cases in the building, so where the persons can be present, so due to presence of that person, it can guard the smoke, so that smoke is consist of the carbon monoxide, so where the person is suffering from the secondary polycythemia. Or if the person is living in the polluted industry, so that industry can expel the monoxide. Okay, so that that candidate can inhaled, due to that also the person was suffering from the secondary polycythemia. So that's why physically primary counseling is important before the clarifications of the pathological variations. If any patient came near to you, then you note down the that is the RBC count is more than 7 millions, then you do not conclude you are suffering from the so tumor. आपको शायद brain tumor है और liver tumor or uterine tumor. First counseling, the nature of work of the patient also, or food style also, associated disease is also. Okay, so then only you can conclude if he is working in the healthy environment, there is no chance of the carbon monoxide poisoning. Okay, so like that you can conclude it with the help of the primary counseling. After that only you can conclude the pathological variations of the conditions. And as well as in chronic heart disease where also the RBC count is increases, then as well as in the inflammation in the lungs like COPD, emphysema. If the person suffering from the COPD or emphysema, simply respiratory inflammation where also the RBC count is increases. If you want to conclude, means you can go for the RBC count in the COVID patients, because COVID patient is also suffering from the respiratory inflammations. So that patient definitely, that patient can be having the high RBC count and high hemoglobin content, because in the respiratory disorder the erythrocyte count is increases, and COVID-19 is a respiratory disorders. So next other conditions, during use of diuretics as well as hypoventilation, the deficiency of oxygen, then those living in the high altitude, kidney cyst and obesity were also the erythrocyte count is increases. Because of in this condition the demand of oxygen is increases, so that can fulfill by our body by enhancing the synthesis of the RBC. Then as well as the person, they are taking the performance enhancing drugs and blood doping sports, for example glucocorticoids is there or testosterone is there, so they enhance the our performance, athletic performance. If they are taking those medication, means definitely so that person is suffering from the secondary polycythemia or the polycythemia, or RBC count can be increases. And as well as if the person is suffering from the sleep apnea, there is a problem in the sleep, okay, then also the RBC count is increases. So regarding the RBC count, if it is less than 4 millions per cubic millimeter of blood, if you found in the result, means so that indicates so that person was suffering from the anemia. Anemia nothing but deficiency of the any kind of the blood cells. Here the anemia means the deficiency of the RBC, or the RBC count is less than 4 millions per cubic millimeter of the blood. And anemia, so there are different types. That is the hemorrhagic anemia due to loss of the blood, then also the anemia is occur. So that type of anemia was known as the hemorrhagic anemia. Hemolytic anemia due to sickle cell or change the structures of the RBC, so RBC was failed to occupy the oxygen. Or thalassemia, so due to thalassemia so where the oxygen cannot be bind with the hemoglobin, so that condition was known as the thalassemia, and thalassemia is a genetic disorder, and such kind of anemia due to structural and shape changes of the RBC, so that condition was known as the hemolytic anemia, or due to deficiency of nutrition. Then also the RBC count is decreases, like that was known as the nutritional deficiency anemia. It is more common in the college girls, because the girls or the women or female, they always want to maintain the physics. So due to physics, maintaining a physics or control the weight, so they can avoid the food or they avoid the healthy food. So due to deficiency of nutrition like folic acids or certain proteins and vitamin B12, so that person was suffering from the deficiency of RBC. So that kind of anemia was known as the nutritional deficiency anemia, that is folic acid deficiency anemia, iron deficiency anemia, or vitamin B12 deficiency anemia like megaloblastic anemia. Okay, so that's why you always have the healthy and balanced diet, because balanced diet is also helpful for to lose the body weight. Okay, so that's why you can prefer the balanced diet, otherwise will be suffering from the nutritional deficiency anemia. And as well as aplastic anemia due to structural changes or malfunctions of the red bone marrow, then also the person is suffering from the deficiency of anemia, so that kind of anemia was known as the aplastic anemia. So that's why, so with the help of the erythrocyte count and having the knowledge about normal count of the erythrocytes, we can diagnose the various kind of the disorders or pathology.